I'd like to introduce our first speaker, Montana Skirka. She's a yoga and mindfulness practitioner and integrative wellness educator. She has 10 years experience guiding individuals through the design and facilitation of workshops and courses aimed at building body awareness and self-esteem to improve mental health and well-being. The passion to this work stems from her personal experience with IBD and childhood cancer. Thank you so much, Montana, for joining us again. She's been with us for several years, giving us the patient perspective.
So the clicker. Hi, everybody. Thank you so much for having me. It's really a pleasure. I often, as a patient, felt quite alone, quite unseen, unheard, just because of the systemic barriers, not because of any of the wonderful work that you all do. So I don't really take it lightly to have this opportunity to speak to all of you, and I really appreciate it, and I think it's really a testament to Dr. Wang and the true multidisciplinary nature of this conference that I have been given this opportunity. So I named my talk Beyond Biology because throughout the day, we're all going to be zooming in quite specifically to specific case studies, medications, surgical protocols. And so before we do that, I thought it might be interesting to zoom out a bit. First of all, to zoom out within the body to recognize that inflammatory bowel disease doesn't just affect the bowels, that we are a mind-body system. And so there are, first of all, we're talking about fertility. So of course, there's the reproductive organs that are affected. There's also the mental health aspects of many people's experiences with this disease. So just recognizing the whole body and the whole mind-body system here, as well as sort of zooming out beyond the kind of biological system to recognize that when we're talking about a patient or specifically fertility, we're talking about relationships, right? Two people potentially that want to start a family together. We're talking about identity. I often talk about in my work that the word patient comes from the word passive. And so when we're receiving medical care, it's good for us to be in a passive role, but we can't take that role with us, particularly if we want to be parents. It's quite an empowering transition in life. So I think that identity piece, and there's also a piece of meaning. And so just recognizing all of this complex stuff that's happening with any patient that you're interacting with. And so, of course, I'm presenting one perspective, being my own experience, but I'm also a practitioner who does a lot of advocacy and does a lot of work with many different patients, both in the oncology realm and in the IBD and chronic illness realm. So I'm hoping to integrate their perspectives into what I provide you all with today. So this is a picture of my tattoo on the back of my neck. It's of a Madagascar periwinkle, which is actually one of the active ingredients, or it was kind of discovered and has become a really key agent in chemotherapy. So the chemotherapy drugs have been vincristine and vinblastine, which saved my life. Childhood leukemia used to be a death sentence. And so that is, for me, a reminder of like this split between alternative medicine and Western. Maybe there's more of a synthesis than we realize. It was really mind-blowing when I realized this connection. And it's also, essentially, when I was cured of cancer, I was left with pretty significant medical trauma, PTSD that was undiagnosed, and struggled for many, many years with pretty severe mental health complications, eating disorder behaviors, anxiety, major depression, which kind of like culminated, I guess, when I was 17 and I was diagnosed with colitis. So I was coming into that experience incredibly dysregulated in my nervous system and, already had sort of, I don't want to say medical mistrust, but a little bit just because of bad experiences I've had and really a lack of trust within myself as well. So I feel like that kind of became this like vicious cycle where I was just in flare after flare because of the past cancer history. They weren't exactly sure what type of medication protocol to put me on. I ended up having a total colectomy. I then had to have an emergency surgery with a perforation, duodenal ulcer. So that kind of increased my mistrust in my own body and everything that was going on, being near death, and then having the J pouch 6 months later. And after that experience, I was just sort of completely in a major, major depressive episode, quite suicidal. And it was like I'd been cured, I'd been given everything that medical professionals were able to give me, and I couldn't find it within myself to keep going. And so because of that, I'm very aware of the limitations that are within our medical system, and just kind of wanting to highlight some of the mental health implications and connections with IBD. Psychiatric disorders are 1.5 to 2 times more prevalent in persons with IBD than general population. 1/3 of persons with IBD experience have elevated anxiety symptoms, 1/4 depression. There's higher rates in women, which I think is also relevant when we're talking about fertility. And so I think that this is going to be at play here when we have patients and when we're talking about fertility. And then also this idea of timelines, because if we're thinking about wanting to start a family, it's that starts a lot of years before. When I was diagnosed with colitis, I was 17. I was just about to go to university and start this new chapter of my life, and all of a sudden I'm bedbound, I'm, in hospitals, I'm embarrassed, I feel isolated from my peers who seem, maybe also had their own struggles, but at the time very much seemed like I was behind in a lot of areas. And because of this kind of cycle of illness, mental health issues, I very much was behind in terms of my career, finances, relationships, and my own sense of independence. And that's certainly, for me now at 35, I feel like I'm kind of just getting the hang of this thing called life. So I think that that's another thing that when we're dealing with our patients, I think one of the main things I'm trying to get across is having these conversations early, checking in early, seeing what supports we can find so that we can help guide our patients through this path, so that they don't necessarily get to be 40 and then are starting to feel like they have their life together enough to make that step. And then the other thing I wanted to talk about was this sense of isolation and despair, because part of the thing that I'm really passionate about, because it was one of the things that helped me so much, was this community element. And I think even if you're talking to a doctor, there's a limit because you don't have necessarily lived experience, unless you have Dr. Wang as your doctor, which you'll be lucky if you do. So I think that and same with family and same with friends. So having that community is really helpful, recognizing that we all have our own path and our own timeline. And so it's really about, I think, finding, and for me, this journey of finding safety and trust and acceptance within myself. I didn't want to accept that I had a chronic illness. It was too difficult for me to accept, so I pushed it away. For many years, I was going from Western medicine, and then not really trusting the doctor, and then going to holistic practice and reading something about goji berries curing Crohn's and trying that for a while, and pinging back and forth and just feeling more and more a sense of despair come over me. And I think that's where, for me, these alternative practices can work in conjunction as complementary to medical, to what you guys are doing, so that we can help support the patient holistically. And just provide that sense of safety and acceptance and trust within your body, which is so important if we want to start a new generation. So it's really these questions about, do we have plans for symptom management? Do we have plans to, how do you feel in your own body? How do you feel in terms of food? I know there's sometimes fear around even food and eating when you have IBD, and how is that going to play out in getting pregnant? Do you trust your body to support you? Do you have a reliable community of support? And so for me, because I was told, throughout my journey, sometimes they would, I've been referred to psychiatry, and medication's been a helpful aid on my path. But I do remember going to a psychiatrist on the IBD floor and kind of just getting a quick prescription out the door, and that wasn't necessarily what I needed at the time. I think that there's other modalities that we can also integrate, and I am such a fan of mindfulness-based modalities and somatic modalities, because it is about embodying and feeling that sense of safety and awareness and understanding within our body. And then just like the importance of stress reduction, right? Nearly 70% of patients with IBD regard stress as an important factor influencing their disease course. 85% report that coping with stress effectively has a positive impact on disease symptoms. So how empowered would they feel if they had these tools and these supports? Because mindfulness-based interventions are effective and are being studied to be effective in improving several IBD outcomes, showing that results showed that stress was significantly reduced in both short and long term. And I remember when I was diagnosed, part of the reason I wanted to push away this illness, I'm like, I went through cancer, that's enough, don't want this, was because I was reading this pamphlet and it said, you know, the quantity of your life may not be affected by colitis or Crohn's, but your quality of life was. And for me, I took that as a death sentence because, you know, what does that mean when you're 17? And so I think helping people, like I said, cope with the reality and kind of maybe even surpass it, which we will get to. So it's really about, I guess, my call for a more integrative and patient-centered care to, like I said, kind of recognize the more holistic experience and ultimately improve long-term outcomes and that's what I do now. I'm so fortunate to work in a clinic, an integrative clinic, and be able to provide that care for patients going through this journey like I did. When I felt so alone, being able to, and I was part of a research team at Sick Kids where I actually went to 8D, the floor that I was a patient, and was able to provide these yoga and mindfulness-based interventions and see the impact on the children and on their parents, which was, you know, I feel so, so grateful to be in this opportunity now where I'm able to give back. I think in my darkest moments, that was always the motivational pull for me, was I know that we can do better, and it's just sort of a systemic thing that we can kind of break through. And so I think that what I want to leave us with is this idea of post-traumatic growth, that we all know from our own lives that it is those more challenging aspects that can lead to growth. And it's not about bypassing. It's not, I remember being told to be grateful that I survived cancer, and that was really hard for me at the time because I hadn't quite accepted it. And then there was a lot of guilt, kind of like a survivor's guilt that I was dealing with. But when you actually are able to accept your reality, to integrate your experiences, there are positive psychological changes that can happen as a result of the struggle. Maybe in self-perception, in interpersonal relationships, in philosophy of life. And that can lead to an increased self-awareness and self-confidence, a more open attitude towards others, a greater appreciation for life, and discovering new possibilities. And so I think that this is what we can, you know, have in mind, that it's not just about managing symptoms, it's about really allowing our patients to thrive in whatever way that means for them. I think that over the many years that I've been presenting and had the opportunity to be a part of this conference, it's been corresponding with my early 30s, where I'm personally really being faced with this question of like, do I want to, you know, expand my family? And I think for me, because of all the medical challenges I've faced and continue to face, quite frankly, it really feels like continuing to nurture and care for my inner child and myself and my nieces and my nephews and my children, my friends' children, is enough for me right now. And I think that's okay too. And sometimes we can see it as a deficit, like we want to get more people pregnant, but I think it's really like helping people define for themselves what they want and helping them achieve that. And so there is no, you know, right or wrong way to live your life. And so thank you so much for allowing me to share a little bit of my story. I'm really happy to continue this conversation with each of you. And yeah, keep in touch. Thank you.